Plus, a sobering new study about skin cancer. What could put you at a higher risk for the most dangerous type? It may surprise you. That story just ahead. Well, the doctor is in on a new study on skin cancer, and you may think that obviously the greater amount of sun exposure that you get, that puts you at a greater risk of getting some type of skin cancer. But a new study shows that's in fact not the case. The more money you have, the more risk you have for getting melanoma. How does that work? We're going to ask Dr. Bruce Katz. He's a clinical professor of dermatology at Mount Sinai School of Medicine. So, Dr. Katz, this study was done by Stanford University and the Cancer Prevention Institute of California. Obviously, reputable places. What's your take on this?
Well, I think this is very valid, and we're actually seeing this in our practice every day. Young women, I think, because of higher income, they spend a lot of time outdoors, spending time in the sun, but also spending an awful lot of time in tanning parlors.
And tanning parlors are still, because of that disposable income, a major reason you see people with skin cancer?
We're seeing it more and more. I just had a 23-year-old young lady in my office who spent years in tanning parlors who just diagnosed melanoma.
You know, there's so many stereotypes about people with disposable income. One of them being they have a lot of education, they have a lot of access to good doctors. They also have access to some of the best and most expensive sunscreen out there. You would think that that might compensate for having the extra money to go tan or go on vacation, but it doesn't?
It doesn't. I think a lot of people still think it can't happen to me, and that's why they go to tanning parlors. They want to look good. But I think also a lot of young women are coming in for skin exams because of that fear.
And so just the more education, we're seeing more reports or more cases of melanoma.
Oh, yes. And people come in, they want yearly skin checkups. I think that's a good thing because they've been in tanning parlors and they're afraid.
It almost thinks that it's so counterintuitive to try to do the same thing, go to tanning parlors and also go to the dermatologist more. But as you mentioned, probably a good thing. I want to ask you about this other report. The FDA is looking at this drug from Bristol Myers Squibb that they have to approve in the next couple of days if it is actually going to get approval. And it's a pill you can take for a certain type of melanoma, and it's supposed to help your immune system fight off cancer potentially. Some people are saying this is really a blockbuster drug. What do you think about that?
Well, I think it's got great potential. This drug really is the first one that has increased survival in patients who have metastatic melanoma. And we haven't had any effective treatments for people who have this serious disease. And this is one of the most deadly cancers, and it's certainly the most deadly skin cancer.
Do you have any insight on how much a pill like that would cost?
I would think it'd be very expensive, but I'm sure people who have this disease will pay anything for it.
Especially if there's no options. Well, we'll look for that announcement from the FDA. Dr. Katz, nice to have you on our show today. Thank you very much.
Pleasure, Jenna. Thank you.
John?